Stroke rehabilitation refers to the part of treatment that a patient who undergoes stroke undergoes after he is discharged from a hospital. When a patient suffers from stroke, whereby he experiences inability to move one part of his body, either both the hands and legs or either the hand or the leg, and he is rushed to the hospital. The most common causes of stroke are either a blockage in the blood vessel that is supplying to the brain, or a hemorrhage or the bursting of a blood vessel leading to inadequate blood supply to the remaining portion. In addition to that, the bursting of a blood vessel also leads to pressure because of the accumulation of blood, and it damages certain other tissues as well. Both these conditions, as soon as they are formed, need to be treated by a qualified neurologist with facilities for managing the stroke. There are wonderful treatments available to dissolve a clot that is resulting in a stroke today in modern medical hospitals which have got a neurology specialty. So a patient, as soon as he is detected to be suffering from stroke, has to be rushed to a facility with a neurology treatment center. The patient is taken care of in that stage, and as soon as he reaches there within very short period of time, which is called as the golden hour. The best is if he can be taken there before an hour, but up to 3 hours is okay as a golden hour. And a patient is able to be taken there within that period of time. There are excellent treatment methods which can dissolve the clots and make the patient reverse the condition of stroke and be as much as normal. However, several patients are taken to the hospital much later, and then they suffer irreparable or irreversible damage to the part of the brain. And that's what happens in stroke. That results in the inability to move certain parts of the body. If it is the right side that is affected, most commonly the patient also loses his ability to speak. So in this condition, the patient is kept in a hospital to stabilize the vital parameters like blood pressure and so on and so forth. And in the case of a hemorrhage, till the hemorrhage, the blood that is accumulated is sort of drained and the patient becomes stable, the patient is kept in a hospital. Post the acute phase of stroke, a patient is discharged and asked to go home and continue with rehabilitation. It is this process of treatment that we call as stroke rehabilitation. Stroke rehabilitation is a very essential part of getting the patient back on his feet and back to his normal activities of daily living. Very often patients with stroke even lose their psychological willpower. They become very depressed at times because suddenly one fine day he is not able to move. And even after the treatment in the hospital, if they are not reaching there within the golden hour, they suffer from sequelae, which is they are not yet back to normal. They are not able to walk, or sometimes they are not able to use their hands, they are not able to speak, and so on and so forth. And they need to be treated very aggressively with excellent rehabilitation to be able to carry on with their normal activities of daily living. This is generally not done in a neurology center, in a specialty hospital. The patient is asked to go back home and contact physiotherapists who can then help the patient. Typically, a stroke rehabilitation program should include the services of a physiotherapist. It also requires the help of an occupational therapist who specializes in movements of the hands and in fine movements that are very essential to carry out the activities of daily living. So an occupational therapist becomes a very important component in the treatment of a stroke patient. If the speech is affected, there is also the need to have a speech therapist as part of the team that is able to treat a patient and help them recover back to their normal activities. It is very, very rare that a patient can get access to this combined sort of a treatment at a home. So they need to take the patient to several centers. Very few centers have full facilities which have all these three facilities under one roof. Very often the patient has to be shifted to a physiotherapist, to an occupational therapist or a speech therapist, and this is generally not done in our context, and thereby the patient's recovery is far from normal. This really impedes their ability to lead near normal lives in the post-stroke phase, and they become totally depressed and the family completely takes a beating. This is very important to understand, that a patient soon after he is discharged from a hospital has to be put through a rigorous course of stroke rehabilitation treatment. It is in this context that we at AVN Arogya Ayurvedic Hospital have established a full-fledged stroke rehabilitation facility with all these components under one roof. We have a full-fledged physiotherapy unit which has got all the instruments as well as the technical people to give them a full-fledged neuro rehabilitation program. We also have the services of an occupational therapist and a speech therapist who can assist the patient in their full range of rehabilitation processes to get back to normal. We have the additional advantage of having a team of Ayurvedic doctors who are extremely experienced in the treatment of stroke. Even traditionally, Ayurveda has been very effective in the treatment of neurological diseases, both degenerative as well as caused by diseases like stroke and so on. Ayurvedic treatment has very effectively been a part of the rehabilitation program in places like Kerala, where stroke treatment has always been carried out by Ayurvedic physicians in the past, post the acute phase. This strength of Ayurveda is being combined with the modern rehabilitation techniques like physiotherapy and so on, and we are able to give a holistic rehabilitation treatment to the patient. It is the observation of even these rehabilitation specialists that patients who undergo only rehabilitation and compared with those who are undergoing an Ayurvedic treatment along with rehabilitation, the comparison is just not there, because the patients who are having Ayurveda with rehabilitation recover much faster, is what even our rehabilitation specialists tell us. They find it much easier to rehabilitate the patients when they are also undergoing Ayurvedic treatment side by side. It is this unique facility that we offer at AVN Arogya as a comprehensive stroke rehabilitation facility. We are getting patients from all over the country, and if they are able to come to us early enough, soon after the stroke, the earlier they come to us, the better is the result. The level of the response is also proportionate to the extent of the brain that is damaged with the stroke. But however, we are able to offer the best form of rehabilitation that can be given to a patient. With these sort of combined holistic interventions, plus we also have counselors who are able to improve the morale of the patient, because that's very critical in a stroke patient. Very often the patient, after he's bedridden, he loses all his self-confidence, and he even starts thinking that he is never going to be better. It is very important for the family to also go through this problem. So they also need a lot of support in terms of counseling and moral support to be able to sustain the positive outlook towards healing, and that is a very critical element of healing. So it is this holistic approach which encompasses the entire range of rehabilitation services, a lot of empathetic and careful care for the patient, and combined with the strength of Ayurveda in neurodegenerative diseases. We are able to see some phenomenal success when we are treating patients with stroke. And this stroke rehabilitation program, I'm sure, will be a very, very important aspect in recovery of the patient post the acute phase of stroke. AVN Arogya Ayurvedic Hospital, 175 Villacheri Main Road, Madurai 625004, Tamil Nadu, India. Call +91 9025 700 400. URL www.avnarogya.in. Centers in Chennai, Bangalore, Mumbai, Cochin, Madurai and Malaysia.